Hi, I'm Dr. Bob Encinosa from Boyette Animal Hospital. Today I want to talk with you a little bit about monitoring heart disease, primarily in dogs, but this also applies to cats. Congestive heart failure is something that we treat on a pretty regular basis. We see a lot of it. In smaller dogs, it is usually from mitral insufficiency, a valve leaking in the heart, which results in a murmur, and that can result in fluid buildup in the lungs. If the heart disease progresses, it can also result in leakage on the right side of the heart, which can also result in fluid buildup in the abdomen. But in the early stages, what we're primarily trying to follow is the amount of fluid that's building up in the lungs, making it harder and harder for them to breathe. And that's called pulmonary edema. It's one of the things that we try to battle the most whenever we're treating heart disease, using things like Lasix, using things like enalapril and pimobendan and other drugs. In the past, we tried to alert owners to watch at home for signs of additional or excessive coughing. Sometimes the cough will be described as productive, meaning they're bringing something up from their lungs. However, that's a little hard to tell sometimes because dogs were never taught to cough and spit. So whenever they do bring something up from their lungs, they swallow it. So you have to watch them very closely to notice if the cough is followed by a bit of a type of a retch or a gag where they may actually be swallowing something. And some dogs cough more than others. So it's not a very reliable thing for us to tell an owner to go home when they start increasing their amount of coughing, let me know. It doesn't work as well as we would have liked. So what we do now is primarily try to instruct you on how to take a resting respiration rate. And the reason that's important is because even when an animal is completely stone cold asleep, their body has to breathe at a certain frequency to be able to get the amount of oxygen it needs. That is a subconscious thing. If they're excited, if they're overheated, all those things can affect that. If they're awake, that can affect that. So we try to take this resting respiration rate whenever they are asleep. They've been inside for a long time, for an hour or more, outside, coming in from being hot outside or from doing any activity, and they're really, really asleep. That is where their body is performing at its basal level, and it tells you whether they're getting enough oxygen from their breaths. Dogs that start having decompensating heart disease will accumulate more fluid in their lungs. They're not exchanging air at the same rate, so they have to breathe more frequently. The resting respiration rate, if you Google it, you'll see anything from 10 to 35. That number is not very important. What is important is to get a resting respiration rate that is normal for your dog or your cat, and then track it. You might want to actually do that 3 or 4 days in a row early on and see what the average is. Perhaps that number is 18, 19, 20, and you come up with an average of 19. In subsequent weeks, whenever you check it, it should be 19 or close to it. If it jumps up by 1, no big deal. If it jumps down by 1, no big deal. If it jumps up 20%, and all of a sudden from 19 it's 24 or 25, things are changing and you need to address it at that point in time. That is actually a better way of detecting early onset of fluid in the lungs and the spiraling downward of congestive heart failure than even taking chest x-rays or us listening with our stethoscope. Basically just counting how many times does the dog's chest or the cat's chest move up and down in a minute, and will be your resting respiration rate. It's just a very easy thing to do at home. Just have to take a few minutes to do it. Find the time and the place where it's most easy to do, because a lot of dogs startle pretty quickly, and you may find yourself laying on the ground trying to watch their chest. That's what you got to do. That's what you got to do. But that is one of the best ways for us to stay on top of heart disease and be able to adjust medications to keep them with you for longer. Thank you.